So today, I will be performing the procedure for hot and cold compress. Before starting the procedure, I will first verify the patient. Good afternoon, sir. I am Danilo C. David, and I'm your student nurse for today from Our Lady of Fatima University. For verification, may I please check your wristband? And kindly state your name and your birthday.
My name is Nixon Garcia, February 27, 2007.
Thank you, sir.
You're welcome.
After verifying the patient, I will now verify the order and I will review the patient's chart if there are any limitations that can hinder the procedure. After reviewing the patient's chart, I will now assess the area that will be treated during the procedure. Sir, may I have your consent for me to expose your leg?
Sure, Ned. Go.
After assessing, I will inspect if there are any wounds, and if there are, I will be checking the color, the tenderness, and if there are any discharge. After checking the area, I will now assess the patient and the family for awareness for the procedure. Assuming that I have already assessed them, now I will assess the vital signs of the patient. Sir, may I have your consent for me to check your vital signs, including your blood pressure, your temperature, and your oxygen level?
Go.
Sir, kindly please expose your arm. Upon checking your blood pressure, sir, it is in normal. It is 120/90. Now I will be checking your oxygen level and your temperature. Your oxygen saturation is in normal level. It is 96. And for your temperature, sir, it is also in normal. It is 36.7. After checking the vital signs of the patient, I can now identify the outcomes for this procedure. So, sir, after this procedure, the expected outcomes are decreased inflammation, decreased muscle spasms, and decreased pain in the area. After that, I will now prepare the equipments. After preparing the equipments, I can now provide privacy by closing the curtains. After that, I will now perform hand hygiene and wear gloves. After wearing gloves, I can now explain the procedure to the patient. So, sir, for today's procedure, I will be providing a hot compress to ease your pain in your leg. And if that's okay with you, may I please have your consent, please?
Go.
So for today, during the procedure, you may feel the sensation of gentle heat in your leg, and also relaxing of your muscles. After that, I can now prepare the hot compress by putting hot water inside it. After that, I will be wrapping a small towel around it so the heat will not be directly applied on the patient's leg. Before applying the hot compress, I will be putting a bath towel underneath the patient's leg. Sir, I will be exposing your leg. After that, I can now apply the hot compress on the patient's leg. Sir, if you feel any discomfort, kindly please immediately tell me. If there are any incidents during the application, stop immediately and assess the patient's area that is being treated. So, after putting the hot compress, I can now remove it. And again, identify the outcomes. Sir, did you feel decreased muscle spasms and decreased pain?
Yes.
So I can now assess that the inflammation decreased. After the application, I can now obtain the vital signs again and compare it to the baseline. Sir, I will be checking again your vital signs to compare it with the baseline. Is that okay with you? Can I please have your other arm po? After checking the vital signs of the patient, I will now continue documentation such as the length of the application, where is the area that is the hot compress applied, and the patient's response. And now I will be performing cold compress procedure. So I will be starting by putting the ice inside the ice bag. After putting the ice on the ice bag, I will be wrapping it with small towel. After that, I will be putting a underpad under the patient's leg. Now, I can put the cold compress on the patient's leg. After applying the cold compress on the area that needs to be treated, I will be removing it, and assuming I will be remoisten the area and reapply the cold compress to maintain the cold temperature. After that, I will be asking the patient if he feels any comfort, and I will be checking if the cold compress is effective. Sir, after the procedure of cold compress, did you feel any comfort and any decreased pain on your leg?
Yes.
After that, I will be now removing my gloves and perform hand hygiene. And then I will be cleaning and drying all the equipment that was used and continue documenting the information such as the length of the application, where the compress was applied, and also the patient's response.